Early on, the doctor wanted me to participate in my treatment, but I just didn't know that was my role.
When you go to the doctor, who decides what will happen with your care? If you would like more input into decisions about your treatment, this video may be helpful.
Hi, I'm going to tell you a little bit about the process of shared decision making. Shared decision making means participating fully with your doctor in deciding what treatment may be best for you. If you share in the decision of your treatment, you will probably be happier with your treatment and make better use of the time you spend with your doctor. In order for you to make good decisions about your treatment, it is important to give key information to your doctor about you and your symptoms. It is also important to get information about your condition and the treatment options available to you.
To use shared decision-making at your visit, it is helpful to tell, ask, choose, and review. An easy way to remember this is to call the process TAC review. The first step in TAC review is to tell.
Think, what does my doctor need to know to help me? It is important to list your concerns clearly and concisely. Preparing a list ahead of time may help you in remembering everything. It will also be important to tell the doctor about situations in your life that impact your illness and treatment.
If you don't remember to mention the problem, the doctor may suggest a treatment that does not address this problem or makes it worse.
It is also important for you to be honest with your doctor about what you are willing to do and not willing to do in an effort to make your situation better. For example, if a medication helps you function better in one way, but causes you to be restless or to gain weight, you may not be willing to take it.
The second step in TAC review is to ask.
In order to engage in shared decision making, it is important to ask questions. You can even write them down to help you remember.
Is this treatment supposed to help with all my symptoms? Is there anything else I can do? Will it cause me side effects? How long will it take to work? How much relief can I expect? What are other possible options? The next step in TAC review is to choose. There are many treatment options, therapy or counseling, different kinds of medications that can treat the same symptoms, different side effects, different ways the same medications can be taken. Based on all the information you receive and input from your doctor and other people you may want involved, you will choose the option you think is best. You can always choose to think about it.
Make sure you have heard your doctor correctly and understand the pros and cons of a suggested treatment.
So this medication can make me sleepy or cause me to have problems with my blood sugar? The final step in TAC review is to review and research. In shared decision-making, it is important to keep track of positive effects of medications and any side effects you may have experienced since your last visit. Is a symptom getting better or worse? Are you experiencing new problems since starting the medicine? You can also do research. Look online. We are used to having pills prescribed. What are some of the problems with taking pills every day?
I went to bed last night and forgot to take my medication. It was all the way over in the kitchen, and I knew I should have got up and taken it, but I didn't.
I was supposed to go to the pharmacy. I didn't. I ran out.
Every morning that I take a pill, it really reminds me that something's wrong. It's like I'm not like other people.
Do any of these issues sound familiar? Did you know that half of all medications prescribed in the United States are never taken? What happens when doses of medication are forgotten?
One time my doctor raised my dose because I wasn't doing so well. He didn't ask, so I had to tell him that I hadn't taken it for a few days.
I see people getting their medication changed. A patient may be taken off of a medication by a doctor because the doctor doesn't think it's working, but really it's because the patient is missing their doses.
I kept missing my medication. I got really sick and had to go to the hospital, and I lost my part-time job.
What can I do besides take pills?
So what would you think about a medication that you could take just once a month?
Once a month? That sounds good.
Once-a-month injections are an alternative to taking pills every day. There are even some that you take only 4 or 6 times a year. I know what you're thinking. I don't want a shot. Or maybe you remember getting a shot in the hospital when staff thought you were agitated. The injection you got in the hospital for agitation was a short-acting injection. Some of these are given when you don't consent to them. Long-acting injections are different. They are a choice you make as an outpatient that may help you manage your symptoms and meet your recovery goals. The choice is up to you. No one really wants a shot, but there are some benefits to consider.
I go to the clinic and get a shot once a month. The nurse is nice. My symptoms are stable, and I actually have less side effects.
I didn't know that if I missed my medication and I started taking them again, that I would end up having worse side effects.
My doctor showed me the scale. It went from 0 to 100. Most people rate the pain about 5 or 6. I think I can deal with 5 or 6.
I didn't even know my medication came in an injection. It was news to me.
Let's look at the pros and cons of tablets and long-acting injections. This may help you make a choice for your own recovery.
Taking pills means that I have to remember to take my medication every day. If I forget sometimes, it may not help me enough with my symptoms.
If I get an injection of long-acting medicine, I have to go to the clinic once a month. They will give me a call to remind me.
Even if I get a long-acting medication, I might still have to take pills as part of my treatment.
Sometimes by taking a long-acting medication, I can be taking all my other medications I don't really need.
When taking the pill, the medicine leaves my system more quickly. So if I quit taking the medicine, my side effects stop more quickly.
With an injection, the medicine stays in my system much longer. So if I'm having side effects and I stop my medication, the side effects will go away more slowly.
With pills, my medication levels go up and down. So if my levels go up, I may have more side effects.
On long-acting medication, my medication levels are stable, and this may cause less side effects.
With pills, I need to remember to call the pharmacy and get a refill. I also have to go to the pharmacy and pick them up, or sometimes get them delivered to my home.
When I'm on the long-acting medicine, it's ready for me at the clinic. Someone calls me, I go down there and I get the medicine I need to control my symptoms.
With pills, my doctor doesn't know how much medication I'm really taking. He may change my medication or raise it because he thinks it's not working well. He may put me on medication that I don't really need or doesn't control my symptoms well.
With long-acting medication, my doctor knows exactly how much medication I'm getting. He can help me decide on whether to go up or down on my dose, depending on how I'm feeling.
Injections can hurt. I gotta take this into consideration and decide whether or not these injections are for me.
Questions to ask yourself that may help you decide between pills and long-acting injection. Have I missed any doses in the last few weeks? Have I had any crisis visits or hospitalizations in the last year? Are my symptoms not as well controlled as I would like them to be? If you answered yes to any of these questions, you may want to discuss a long-acting injection with your doctor. Look at the pros and cons handout that looks at taking pills versus long-acting medication. What do you think?